if you're a healthcare provider and you're not at an academic center and you haven't done much genetics training other than maybe with your CME courses, it can feel very isolating when you've been given results to call it on a baby who's got a genetic condition. And one of the most effective things we've had is first, see if you can consult with a genetic counselor or medical geneticist who's familiar with that condition. Most of the disease experts in lysosomal storage diseases are more than happy to talk with you about what they know and how they give that news to families. Because this call is critical. The call from the healthcare provider to the family is what they're going to remember for the rest of their lives. And even though it's never fun to be the bearer of bad news, if you can call them and say, your baby appears to be affected by, Krabbe disease. However, there's a center of excellence that can help you travel and have funded travel to get a full assessment, and now there's trials in gene therapy that your child may qualify for. Or your child has Pompe disease, there is an FDA-approved therapy that has been really effective. Or if there's no therapy at all, just saying, we can still do everything possible to make your child comfortable and give them the best possible outcome. But this is going to be hard, but I'm going to be there for you, and let's talk about what we do next. So, getting connected with someone who's really familiar with the condition, and it may feel like you don't have time for that. If you don't have time for reaching out to anybody, nobody's getting back to you quick enough, you can always look at Gene Reviews, which is a great online resource where experts write very detailed summaries about genetic conditions. And then I always recommend looking at the patient advocacy websites. They tell their stories, they tell you what's latest in research, and they really do a very nice job of helping you understand what it means for a family to have a condition. So I would say, Googling's not ever the best, but if you've got a reliable patient access website, if you've got Gene Reviews, that would be a great place to start if you can't get in touch with an actual individual who works with patients that would be available to you pretty quickly.